Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today I'm going to continue our talk on alopecia areata. And as you recall, last time I mentioned, this came about from a friend who wanted me to talk about this and just elaborate a little more about it. And so I mentioned in the past, the last episode, that, well, it's unpredictable. And this is when your body, alopecia areata is when your body attacks itself for unknown reasons. And the problem is it's really unpredictable. So you can have alopecia areata in which one location on your scalp, one small area of involvement, or you can have totalis, which is all your hair on the scalp is all gone, or you can have alopecia areata universalis, in which your entire body has lost all the hairs, eyebrows, arms, legs, private area, as well as your scalp. And then, of course, there's alopecia oviasis, in which you have a loss of hair as a band around the scalp. So those are various presentations, and like I stated, the problem is it's very unpredictable. One day you have hair, next day you may have a small area of hair loss, or the next day you notice you shedding even more, and then you lose all your hair. And of course, it can come back, but you never know when, and what did you do differently to make it happen. So today we're going to talk about treatments for alopecia areata. And keep it in mind, like I stated, it is unpredictable. So if the product that your doctor prescribed or what you're doing is working, perfect, stick with it. But if it comes out again, that's not to say the product is not working. It's just that's your alopecia areata doing what it thinks it should do. So number one is medication. Number two is, of course, self-care. And as far as medications are concerned, the mainstay is really corticosteroids, in which we can prescribe it as a prescription by mouth, or you can get an injection in the arm. And of course, another way of treating or administering corticosteroids is intralesional, in which we inject just the location that you have alopecia areata. And of course, we can write it as something you rub on, like a topical presentation product that you would use like most likely twice a day. And so that's one major treatment, and it works very well. It stops the inflammatory cells. And your hair, like I stated, your body grows hair, which it can always do. Your body never loses the ability to grow hair. It's just that it's inhibited from growing hair. So steroids or corticosteroids will help with that. Number two is minoxidil or Rogaine over the counter. That works. I prefer the 5% for my adult patients and the 2% for my pediatric patients. But that's twice a day. Give it time. It does help. It does grow hair. And of course, there is tar products, tar-containing shampoos that you can get prescriptions for, or you can get the one over the counter, which is like your T-gel. And so those are options for you. As far as self-care, you want to avoid your foods that causes inflammation. So you want to avoid dairy products. You want to avoid or at least decrease the amount of intake of them. And you want to really start eating more products that are good, high as containing antioxidant products, such as your omega-3s, as well as a lot of your leafy vegetables. So if you want to go the natural way, that's how you can do that. A lot of people think that, the alopecia areata started from stress. If that's what you think is the case, then get rid of the stress and see what happens. But if not, definitely the things I mentioned, you want to get that use those options as treatment modalities. And of course, another something that is not commonly used, but you definitely want to go to a dermatologist or a person that specializes in hair disorder, is diphencyprone, which is an immunotherapy product in which they put this chemical on your scalp or wherever you have hair loss, and it causes a contact dermatitis, and therefore that causes your hair to grow back too. And for other things you can do as far as, it's not really treating the condition, but masking it, is of course getting a wig. Something so you can hide it, or eyelashes. If alopecia areata has affected your eyelashes, you can get eyelashes put on. So those are other options or ways you can mask it until you get over or it resolves, if it can, or if it does resolve. But those are your options. Any questions for me? Hello, how you doing, Miss Margaret? Good to see you watching. A pleasure. Okay, so anyone have any questions? Well, great. Thank you again for joining me. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. Thank you for watching, and I will see you tomorrow. Of course, follow me on Facebook or join our Facebook community, GorgeousGalCrew.com. GorgeousGalCrew.com. Take care. Thank you. Bye-bye. Oh, but I do have a question. Hold on. Let's see. Do your hair comes back after you stop the regrowth product? It can. It can come back. The problem is, will it fall out again? That's the problem with alopecia areata. It's very unpredictable. So that's the problem with alopecia areata. So yes, if that product is working for you that you're using, keep using it. Keep using it. And once you realize it's not working any longer, or it's not working for you, then try something different. Okay, great. Thank you and love you too. Take care. Bye-bye.